Welcome to this episode of MedTech Minis. I'm your host, Susie Ingwell, and today I am excited to have Robert from Baton Health join us. Welcome to the show, and tell me a little bit about yourself.
Well, thanks for having me, Susie. Excited to be able to share what we're building at Baton. I spent most of my career in nonprofits and policy work, so I know how difficult it is when resources are tight and constrained. And for the last 10 years or so, I've been working in the credentialing space, where we know that med staff services and other credentialing teams have a very similar experience. And so that's kind of what our focus is on how we can help empower them.
I love that. Tell me a little bit about kind of the problem you set out to solve when you created Baton Health.
Well, we refer to this problem as the single dumbest problem in all of healthcare. And by that, I mean, there are few problems that are as widespread, take as much time and effort, and cost as much, not only directly, but also in terms of the revenues that they block organizations from bringing in. And so what Baton is doing is working to automate parts of the licensing and privileging and payer enrollment processes. We're simply eliminating all of the manual data entry, and most importantly, eliminating the work for the clinicians in that process.
Amazing. I mean, that data entry is such a challenge for everybody with everything, and to have credentialing be a bigger part of that when it really doesn't sound like it needs to be. I'd love to hear more about the solution that you've created. So tell me more.
Well, if you were to talk to clinicians and ask them about credentialing, their eyes roll in the back of their head because it's such a pain for them. But the reality is there are solutions we've seen in other industries. And the best way to think about this is actually by thinking about consumer finance. So if you were to go to your bank and ask for a $10,000 loan, they don't ask you for every bank you've ever banked at, every credit card you've ever had, and every loan you've ever taken out, all of your debts and payments. They simply ask you for your social security number. And with that, they can hit the credit bureaus who have federated all of that data from every financial institution. And in milliseconds, they get back all of the data they need in order to make an accurate and compliant decision. The same thing should be possible with credentialing. And so that's what Baton is focused on. We're gathering every piece of primary source data on every clinician of every type in every state. And by having that all in one place, hospitals, health systems, payers, providers themselves can do a single query and get back all of that information straight from the primary sources.
Amazing. I think we desperately need this. So tell me more about where you are. You're on market now, and tell me what that looks like for you.
Yeah, well, we started building about 2 years ago, and our first customers came in just a little over a year ago. And so now we've got a full annual contract underway with many of them. In fact, our very first customer was the Cleveland Clinic. We power their virtual second opinion program. So increasingly, we're starting to see a lot of traction with telehealth and virtual care providers. But more recently, hospitals and health systems and payers who've come under let's say, increased scrutiny and more regulatory constraints, they've started to come in as they seek to automate more and more of their primary source verification and ongoing monitoring needs.
I'm so glad to hear that, because I feel like they're the ones who need this the most. And I think it's awesome you have Cleveland Clinic in there as kind of your first initial customer, your first initial launch. They're obviously a well-known name. That's a huge thing for anybody, for any startup. But I do think a lot of hospitals tend to follow in their footsteps. So amazing. How do people get a hold of you if they want to learn more, want to potentially bring this into their hospital?
Well, you can come visit our website, batonhealth.com. We're also on LinkedIn. And soon we're going to be available through a number of GPOs. So members can contract with us directly.
Fantastic. Thank you so much for your time today. This is an amazing startup or amazing company. I'm really excited to kind of see it become sort of a standard for all of the hospitals in the US. Anything else you want to add before we shove off?
Well, I just think it's about time that we have enterprise-grade infrastructure for sharing this data. And Baton Health is so excited. We get to be the rising tide that lifts all boats. We can help clinicians themselves, as well as all of the organizations that they work with one single, simple solution. So thank you for letting us share that.
This was great. Thank you so much for being my guest today.
Thanks so much for having me, Susie.